Botulism, a very rare but very serious paralytic illness. A lecture with Tiffany Alvarez. That's me, and my friend Abhinav Dasu. Abhinav.
Hey.
So what is botulism?
I know. It's caused by bacteria, right?
Abhinav, if you would have read your textbook, you would have realized that that's not the case. Botulism, that's a misconception. Botulism is actually caused by the toxin that's secreted by Clostridium botulinum as part of its metabolic waste. So it's not the bacteria specifically that causes it, it's the nerve toxin that it secretes. What this nerve toxin does is exactly interfere with muscle movement and with nerve functioning. It blocks the production and the release of acetylcholine, which is something you would have learned if you would have read your textbook.
I'm sorry.
So where is it found? It's everywhere. It's in soil, it's in water, it's in the stool of infants, and it's in inadequately preserved food. So if it's everywhere, why is it that we don't see botulism? Why is botulism rare? Why is botulism a rare and serious paralytic illness and not botulism, a serious and very, very likely to affect you paralytic illness? Well, that's because we have antibodies that are able to counteract the effect, but children don't. And there are different ways in which you can get botulism, 5, which are identified by the World Health Organization. The first and most common is infant-based botulism. The CDC in 2010 recorded 124 cases of botulism. 65% of those 124 cases were infant-based. How does this happen? Well, the FDA seriously advises against feeding your less than 1-year-old child either honey or corn syrup because we see that these substances usually contain the bacteria, and if the bacteria is introduced into the child within the first months of life, first 12 months of life, then the child isn't able to, the immune system isn't able to adequately counteract the nerve toxin that the bacteria produces, and so it affects the intestinal tract, and bam, botulism. The second most common way of getting botulism is wound-borne. It accounts for 20% of the cases that we CDC reported in 2010, and curiously is linked to serious heroin use in Northern California.
Oh.
So, yeah, drugs, bad, heroin especially, injecting stuff into you, anything that touches your blood, man, stop. Okay, the third way is foodborne, and that's the, inadequately preserved stuff that I was talking about. Like, we see that, in cans, or people that can their own goods and don't do it right. That's a problem. Or canned food that's really old, or we see, cans that are kind of ready to explode and really fat. Stay away from those too. And again, it's introduced into your system, into the intestinal tract, it decreases the nerve toxin, bam, it gets you. The fourth way is adult intestinal toxemia, and the mechanism for this is very similar to that of the infant, but the thing that we see here is it doesn't happen with infants, it happens with adults, and adults that usually have pretty weak immune systems. The fifth way is something called iatrogenic botulism, and that's basically an overdose of your system is always exposed to this toxin, but your system finds ways of being able to control it, but once it's overwhelmed, it's then overcome, and you can't really do anything about it.
So, are you saying an overdose of Botox would also cause this?
Well, Abhinav, I know you didn't read your textbook, but you do know that botulism is actually, or that botulinum is actually in Botox. So good for you. Yeah. Yeah, Abhinav.
Thank you.
Botulism, Clostridium botulinum is actually used in Botox ingestions, but the treatment is usually very diluted, and they usually are able to measure the amounts that are adequate. And of course, if some sort of malpractice were to happen and you were given incredibly large amounts of Botox, specifically in one specific area, then maybe you would get iatrogenic botulism. But as I said before, the CDC in 2010 only reported 124 cases, and out of those 124, the fourth and fifth method of obtaining or getting botulism were at the 0%. So nothing to worry about. I mean, that's a misconception.
Okay.
But let's say you were to get it. What would be the symptoms? Well, there's a symptom timeline. We usually see that with foodborne botulism, symptoms manifest either as early as 6 hours from introduction to as late as 10 days. On average, though, we see individuals experience symptoms sometime within 18 to 36 hours of exposure. And once we do see these symptoms manifest, we see that they first affect the cranial voluntary nerves. So the first thing that it gets to is basically all that stuff in your face, everything that you control, have voluntary control of over your face. It all slowly becomes paralyzed. Your eyelids get droopy. It's hard to blink. That picture we showed, or that at the very beginning of the lecture, that guy, totally conscious, but he looks like just spaced out. And that's because his face is paralyzed. Does he have a fever? No, he does not.
Oh.
Strange, right? Because
Bacteria.
and infection and disease, and we think infectious disease and bacteria, we'd fever. No fever. That's one of the misconceptions. Like I said, it affects the cranial voluntary muscles and nerves first, so not only can you not blink and not, your eyelids get heavy and you can't really move your eyes around, it also becomes difficult to swallow, it becomes difficult to talk. And as time progresses, the symptoms get worse and worse, and eventually it's not just your face that's paralyzed, it's everything else. It gets to your other limbs, and your muscles, both sides of your body equally experience a slight dullness and numbness, and slowly but surely everything becomes paralyzed. You'll get tummy aches, and your tummy will ache because your intestines are slowing. It's not moving. That stuff isn't not moving, but it's not working. It's slowly but surely becoming paralyzed, which leads to constipation. Those little tummy pains, constipated. That's one of the ways that you're able to identify whether your infant has botulism. Is he or she constipated? And does he or she feel lethargic or look lethargic and move slowly and seem tired? It ultimately, after it having affected, not just like the cranial muscles and nerves and the outs, like your limbs and your intestinal tract, it affects people that die of botulism because they can't breathe. And usually the things that we see, like with patients that get botulism and who weren't introduced to the nerve toxin soon enough, they usually have to be hooked up to like respiratory machines because they aren't able to breathe on their own, and obviously if you can't breathe, nothing else works, you die. So that's the actual killer, respiratory failure. What starts as just difficulty starts as difficulty in breathing turns into just an inability to do so, not supplemented by the fact that the oxygen you inhale turns into CO2 that you can't exhale, and it kind of like poisons or just isn't good for you. Another problem, or a problem with a misconception, is kind of also a misdiagnosis. We see that the symptoms are often mistaken for either Guillain-Barré syndrome or myasthenia gravis, or even stroke because, the facial muscle paralysis. But the way to be able to make sure, assess whether or not your patient has or whether you have botulism and not something else, or experiencing a stroke or something, is to go to the doctor and to get a blood, semen, urine sample. Just kidding. Not semen, not blood. All you need to do is check your stool or your intestinal tract or or stomach contents for the bacteria, the presence of the bacteria, or the presence of the nerve toxin. Yeah, so you have the symptoms, things are bad, how do you treat it? Treatment is variable. It depends on the method by which you got botulism. Do you have is it infant-based botulism? Is it wound-based botulism? Is it foodborne? What is it? Treatment will vary according to method. Usually, though, the thing is, the sooner you catch it and the sooner you start treating it and introduce the antitoxin, the better, and the less of a risk that you will experience long-term complications after recovery. Like individuals who don't die from botulism but have experienced it or have had it for like long periods of time, usually, never, and nothing's the same again. Difficulty breathing, people do feel lethargic and still. But basically, there are two different types of antitoxins. The first, both of them work by the same method. The idea is to stop the bacteria from circulating and get into the blood and circulating into the whole body by effect. And there's a specific antitoxin called the baby big. Big is an acronym. And it's specifically for infant-based botulism. If you have a wound, though, that's infected because, well, you've been doing too much heroin or something, what you need is to go get surgery and have the infected area treated and the tissue that's infected taken out. And usually this is followed by a course of antibiotics. So that's pretty cool. Botulism. Any other questions, Abhinav?
I'm good. You have cleared most of the misconceptions I had. Thank you.
Yeah, you're welcome. Okay.
Bye.
Bye.